And I'd like to illustrate the practical benefit of the involving users as experts model with a short story about one of our participants. Back in 2004, Alan was invited to join a patient group being set up in the rheumatology unit of his hospital. Immediately, the group came across a number of obstacles. In particular, a lack of understanding of the workings of the NHS, difficulties with the complex language and vocabulary of the health system, and a sense of deference towards health professionals, which meant that the group did not feel confident or strong enough to make their voice heard and to challenge medical staff if needed, which meant that in the end the NHS largely remained elusive and quite impenetrable to them. After attending one of the training courses in Loughborough in 2007, Alan felt much more confident, knowledgeable, and empowered and motivated to make a difference. He recreated a service user group involving health professionals as well, and together they worked with the NHS to establish a patient-led information room and resource centre in the hospital. As a result of that, Alan has gone on to be very involved with the health service. He has been approached by the health service for his input, demonstrating that health professionals valued the relationship that he and the user group that he established were able to bring to the table. And I think Alan's story is a powerful demonstration of how a more engaged, inclusive, and genuinely empowering model of involving users really makes a difference. So what are the next steps for involving users as experts? Well, clearly we'd like as many PCTs as possible to adopt this approach, but the first thing we're going to do is we're going to review the course in the light of the recommendations of the evaluation, as I touched on before, to make sure that it is delivering everything it can be. We will consult further with PCTs in particular to make sure that the course genuinely reflects their needs and what they would like to get from the course. We will look to broaden the scope. As I said, there's no reason why this course can't be applied to a whole range of service users. We're going to look at the possibility of turning it into a modular course spread over several weeks, which would eliminate the residential aspect, thereby clearly saving on cost, with no detriment to the ability of the participants to bond and interact with each other. We'll also consider the possibility of producing an online version of the course, which will make it much more widely accessible. And Arthritis Care is incidentally launching an online version of one of its self-management programs next Monday, Challenging Pain, which will provide, hopefully, a learning experience for that. There is a possibility also of aligning the involving users as experts model with self-management in terms of being a natural progression for people who go on self-management courses and want to continue to be more involved with the health service. And finally, I should say that we are going to run a fringe workshop on involving users as experts at the NHS Alliance conference this year, where we're also going to have a member of a PCT that worked with us and a service user who will be able to give people their experience. So that's the end of the presentation, and I hope it was interesting.